Hello, this is Dr. Lavanya Pediatrician from 𝗼𝒄𝒄𝗿 Hospital. From 1st of August till 7th is breastfeeding week. So I thought I would just answer a few questions that are commonly asked by parents. Each day one question will come and the answer to that will come. This year, 2023, is World's Breastfeeding Week. The first question that many people ask me is, am I producing adequate milk for my baby? How will I know that my breast milk is sufficient for my baby? Okay. So if the baby is passing 6 to 7 times urine from day 3 of life, then it means that the mother is getting adequate breast milk. If the baby is on exclusive breast milk and the baby is passing 6 to 7 times urine per day. Okay. If the mother has breast fullness after feeding the baby, that is after half an hour or so after feeding the baby, the mother then has engorged breast later, which increases by after 1 or 2 hours, then that shows that the baby is getting adequate breast milk. If the baby is satisfied for about 2 to 3 hours after having a feed from the mother, that shows that the breast milk for the baby is adequate. If there is a good weight gain of the baby, usually there will be a 10% weight loss in the first 10 days for the baby. Subsequently, there will be a weight gain. If the weight gain is adequate, then that shows that the baby is getting adequate breast milk. The mother can also be having dripping of milk from one side of the breast that is said to be letting down when she is feeding on the other side. This also shows that she is getting adequate breast milk. That the mother commonly asks is, if I'm not having adequate breast milk, how do I increase my breast milk? How do I increase it to be adequate for my baby? Okay. So this is by frequently nursing your baby. That doesn't mean you have to nurse your baby half an hour and hourly. You can nurse your baby second to third hourly. Okay. And the baby should latch well and suck well. Okay. The nursing should be second to third hourly. And in between, if you feel that your breast is slightly engorged and baby is not requiring the milk, the mother can pump the milk and store it. Okay? She can express the milk using her hand and using sterile containers to keep the expressed milk, or she can use a breast pump also to express the milk. Another thing is, the mother should not be stressed. Okay? Too much of stress in the mother, too much of worries can also decrease the breast milk supply. So she should try to be calm, as much as calm as possible. Get her adequate sleep when she's not having to handle the baby. Let her have her rest periods. Have an adequate, balanced diet with plenty of fluids. There are certain foods that can also increase the breast milk supply. Some foods like oats, garlic, bottle gourd, thyme, and fenugreek. Pomegranate can also increase the breast milk supply. So these can also be part of the mother's diet. Breasts. So why does a mother get engorged breast during breastfeeding? When the mother is producing more milk than what the baby is having, then she can have engorged breast. This usually happens on day 3, 4, 5 days after the baby is born. So how do you relieve this engorged breast? Why does it happen? One is, there is too much of milk stored in the breast, and also the ducts inside the breast can get blocked. So because of that also, the mother can have an engorged breast. How do we treat the engorged breast? She can use warm water pads, apply it over the engorged breast, and then massage the breast from the breast towards the nipple and express the milk out. Let her let down the milk. After she lets down a certain volume of milk, she can also make the baby breastfeed in that breast. Some people say that cabbage leaves, also when applied on top of the breast, give some soothing effect in the breast engorgement. Painkillers can also be utilized in relieving the breast engorgement. When a mother has breast engorgement, she can have symptoms like pain in the breast and and sometimes fever also. So this has to be addressed soon, and it can be relieved by letting down the milk out and soothing painkillers being given to the mother. 2 weeks of breastfeeding, the mother can have sore nipple. Sore nipple is usually because of improper latching of the baby on the breast. This can be this usually occurs when the baby is only sucking on the nipple and not all, the black portion around the nipple, the areola, is also not inside the baby's mouth. So normally when a baby is sucking, the nipple as well as the black portion around the nipple, the areola, should also be in the baby's mouth, because it's only when the baby sucks on the areola that the baby will get milk. And when the baby only sucks the nipple, since the baby is not getting milk, the baby will start biting the nipple and the mother gets a sore nipple. So the first treatment of the sore nipple is to find that the latching is proper. If the mother is not able to latch the baby in a certain position, she can change there are different positions in breastfeeding which she can try to get the correct latching position. When the mother is not breastfeeding the baby, the nipple should be allowed to be dry. Mother should change her breast pads frequently when they are wet to prevent infections around the nipple. Apart from that, the mother can also apply an expressed milk from the breast where the baby fed over the sore nipple. This can help in healing of the sore nipple. Coconut oil can also be applied over the sore nipple. There are other ointments also available in the counter which can be used. This is lanolin based, which can be applied over the sore nipple. But such medication should be cleaned well with water before the baby is breastfed. First weeks of life, a mother has difficulty in getting a proper latching. Some mothers might have difficulty in getting a proper latching. Some mothers might find it very easy. So how do you know that your baby is latching well to get when the baby is receiving the milk from the breast? So the proper latching position can be achieved by first making the baby, how do you encourage the baby to have a good latch? One is when you bring the baby towards the mother's breast, I've put a picture here for this question. Just see that also. Make the baby's upper lip touch the nipple. Once the baby's upper lip touches the nipple, the baby will start opening the mouth. Once the baby opens the mouth, the mother can just introduce the nipple with the areola inside the baby's mouth, and hence then the baby will start latching properly. So after the baby latches, how do you know this is the right latch? A right latch will be where the nipple and the upper portion, almost the entire upper portion of the areola, the black portion that covers around the nipple, is inside the baby's mouth. The cheeks are full, the lower mouth is flanned out, and the mother will not be having any pain during the breastfeeding. Doubt, should I have any specific diet during breastfeeding? Should I restrict certain types of food during breastfeeding? So a mother usually basically does not need to restrict her food. Usually, she should have a balanced diet with plenty of water. She should not take diets which are causing bloating, and she should not have much of spicy diets also. Okay. There are certain foods which increase the mother's breast milk production. Foods like fenugreek, pomegranate, oats, bottle gourd. She can try to have each of these foods in different times in her diet also to enhance her breast milk production. This is something some mothers usually ask when they have a cough or cold or just a viral fever. Should they stop breastfeeding their baby? No. The immunity for the baby will come through their breast milk. But then mothers would be worried, will my baby get the cough or cold that I am having when I breastfeed because of the baby having contact with me? The mothers can sanitize their hands, they can wear a mask and then breastfeed their baby. When they are not breastfeeding their baby, maybe they can keep the baby slightly away from them to avoid any infections. Actually, the breast milk itself can provide the baby immunity against the infection that the mother is also having. Certain conditions are there where the mother should not breastfeed. Like if the mother is having cancer on chemotherapeutic drugs, or if the mother is HIV positive, very, very active pulmonary tuberculosis. In these conditions, maybe we might consider not breastfeeding, but other ways when the mother has illnesses also, she can breastfeed the baby. Express my breast milk and store it. Mothers can try expressing their breast milk when they feel their milk supply is not adequate. The mothers can try expressing their breast milk, because the more she lets down the milk, the more she will get increased production of breast milk. Working mothers can also store their breast milk. For preterm babies, we store the breast milk because the babies might not be able to latch immediately on the breast, so they can have the expressed breast milk. When there's lots of breast engorgement, then also the breast milk can be expressed. So how do you express the breast milk? The breast milk can be expressed using your hand or using a breast pump. If in whatever way the mother does it, everything should be sanitized well. The mother should wash her hands well, and she should use sanitized sterile containers which have been washed in soap and boiled in boiling water for 10 to 15 minutes. She should take those containers and express the breast milk in those containers, and she should use a sticky tape and label it saying the date and the time when the milk was expressed, so that she will know how many hours she can keep the breast milk. How do you store the breast milk? The breast milk can be stored in room temperature, it can be stored in fridges, it can be stored in freezer. In room temperature, the milk can be stored up to 6 hours. In fridge, it can be stored up to 24 hours. In freezer, it can be stored up to 3 to 6 months. Always remember to label the breast milk that is expressed, so that you will not use it beyond the expiry date.